Hello everyone, I'm Dr Evie Kendal and it is my great honour to welcome you all to the Ethical, Legal and Social Issues in Epigenetics, Indigenous, National and Global Perspectives Virtual Symposium. Although we are all in different nations, on behalf of those present, I acknowledge the traditional owners of the lands on which we now meet. I pay my respects to their elders, past, present and emerging. In particular, I respectfully acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional owners of the land on which I am standing. I also pay my respect to all Aboriginal and Torres Strait Islander people of Australia and other nations, and hope that the path toward reconciliation continues to be shared and embraced. So who are we and why are we here? This symposium brings together bioethicists, clinicians, epidemiologists, policymakers, genetic counsellors, health lawyers, geneticists, medical educators, research students, and more. We especially want to welcome our First Nations speakers who are so generously sharing their expertise and perspective. Advances in epigenetics research and testing technologies carry with them a plethora of ethical and legal challenges. This symposium explores some of these issues. As an emerging technology, there are unknown risks associated with the collection and use of genetic information, including for genetic diagnosis, ancestry testing, and precision medicine, for example, personalised cancer treatments. As such, it is necessary to engage an interdisciplinary approach to establishing ethical and policy guidelines for development in this area to ensure the benefits are equally distributed and potential harms are minimised. This symposium will cover some general bioethical issues surrounding epigenetics research, including informed consent in the context of uncertainty, the ethics of genetic biobanking, privacy protection for genetic and epigenetic big data, and public education and engagement in the area of genetic and ancestry testing. These will be considered on a national and global level, incorporating the perspectives of various countries. However, the main focus will be on the ethical, legal and social implications of epigenetics research as it affects Indigenous populations. As genetic testing has historically been used to further disadvantage minority groups, including through blood quantum laws, engaging Indigenous stakeholders in policy development and training geneticists and other health professionals in culturally aware practices is essential for the benefits of this research to be shared equitably across populations. Our aims in this symposium are therefore to foster discussion across these professionals to ensure that the benefits of new developments in the fields of precision medicine, epigenetics and personalised care are available to marginalised populations as an ethical imperative. Also to increase the involvement of Indigenous communities who have historically been uniquely affected by genetic research in developing governments and standards for the clinical application of precision medicine. Our first session will be focused on genetic research and clinical genomics for Indigenous people and covers topics such as individualised healthcare, policy considerations regarding tribal government consent, data sovereignty issues, participatory research methods, and enhancing engagement among Indigenous groups with clinical genetic services. Our second session, entitled Consent and Communication in Genetic Research, focuses on improving comprehension and informed consent for genomics research and developing culturally appropriate clinical genomics and phenomics systems. Session 3, the ethical, legal and social implications of precision medicine, will look at the broader ethical context of precision medicine and the potential to limit heritable genetic modifications and treatments. It will look at home genetic testing data and the potential for family notification for genetic results. It will also be concerned with protecting parents from blame for epigenetic influences on offspring, and finally considering epigenetic research and translation. We will conclude the symposium with a roundtable discussion, Where to from here? Key issues for throughout the symposium include informed consent, data privacy and clinical research ethics, biobanking, repatriation of First Nations biospecimens, cryopolitics and data ownership, cultural awareness in Indigenous epigenetics research, clinical genetics and policy, and public engagement and education on epigenetics and direct-to-consumer genetic testing. Once again, it is my honour to welcome our esteemed speakers and participants to the Ethical, Legal and Social Issues in Epigenetics, Indigenous, National and Global Perspectives Virtual Symposium. Thank you.